Good morning. My name is Tanya Williams, and I'm the Healthcare Innovation Manager for the Louisiana Department of Health, Bureau Well Ahead, Louisiana. I serve as the lead for telehealth initiatives to deliver innovative strategies and increase access to healthcare for Louisiana residents. I also lead Project ECHO Extension for Community Healthcare Outcome Initiatives, and I serve as the Louisiana Site Coordinator on behalf of Texla Telehealth Resource Center. Through this organization, I provide technical assistance, program development, and business strategy guidance related to telehealth implementation. Today, the Louisiana Department of Health is hosting the first masterclass of our Health Equity and Action series. The goal of this series is to increase understanding to ensure everyone has what they need to live their healthiest life and to equip people with the tools for improving conditions where they born, work, live, learn, worship, and age. This series consists of quarterly masterclasses, webinars, and in-person events. We aim to educate and inspire action towards bridging the gap created by health barriers. These events are open to healthcare providers, community health workers, public health and social service practitioners, and community members. I will be moderating this conversation. The topic of this quarter is identifying social determinants of health in the community. Today, I will be conversing with David Lehman, Program Manager for the Governor's Broadband for Everyone in the Louisiana Commission, and Michael Tipton, President of Blue Cross Blue Shield of Louisiana Foundation. The goal of this conversation is to increase awareness about barriers experienced with broadband and COVID's impact on these broadband barriers, strategies and resources for improving broadband and telehealth access for all Louisianians, and discuss lessons learned. Before I introduce the speakers, I'd like to share information about Texla. The Texla Telehealth Resource Center is a federally funded program designed to provide technical assistance and resources to new and existing telehealth programs throughout Texas and Louisiana. The Texla TRC will continually evaluate telehealth programs in these two states for effective delivery of telehealth services, efficiency, sustainability, and patient satisfaction. They will also develop an interactive hands-on training center to provide guidance in telehealth planning, implementation, management, and sustainability. As mentioned, I serve as the Louisiana site representative for Texla Telehealth Resource Center. The first speaker I'd like to introduce is David Lehman. David specializes in government and public services with a focus on grants, policy, and infrastructure. Before joining the Louisiana Governor's Office of Broadband Development, Connect LA, David spent 2 years working for the Louisiana legislature as a budget analyst, creating data visualizations for lawmakers, and oversaw the tracking of American Rescue Plan Act dollars and the $800 million replenishment of unemployment insurance trust fund. This skill set is benefiting Louisiana as the state manages over $1 billion in broadband grants from the bipartisan infrastructure law over the next 5 years. Since joining Connect LA, David has been instrumental in working with key stakeholders to draft comprehensive infrastructure development policies, unlocking $1.35 billion in federal grants. He also represented Louisiana by speaking at conferences such as Minority Business Development Agency Summit, Southeastern Association of Regulatory Utility Commissioners, Broadband Community Summit, Quit Network, Encompass Show, and Digital Government Summit. David is committed to increasing economic, educational, and telehealth opportunities for all. In his spare time, David enjoys cycling, reading, and rooting for Brazil's national soccer team. Our second speaker is Michael Tipton. Michael serves as president of the Blue Cross Blue Shield Louisiana Foundation, as well as serves as the director of community relations for Blue Cross Blue Shield Louisiana, beginning both roles in the summer of 2015. In that capacity, Michael oversees corporate and foundation grant making in excess of $3.5 million, as well as other projects in support of improving health and lives in Louisiana. Over the last 2 years, Michael and the foundation have committed $22 million to relief and their traditional work, 5 times the normal giving, as well as led various other efforts around community collaboration to improve health and life outcomes. Michael previously served as executive director of Teach for America in South Louisiana, as a teacher in New York, and as a consultant focused on nonprofit growth and collaboration. Michael is a Louisiana native, having attended LSU, and was named LSU's Young Alumnus of the Year. Michael and his wife Sarah live in Baton Rouge and have two young kids, Alexander and Eleanor. Before we begin our conversation, we need to define some commonly used terms. Mr. Lehman, could you define broadband opportunities?
Absolutely. So broadband opportunity, a lot of people, when they think about broadband, and first off, can you hear me?
Yes.
Great. And thank you for the fantastic introduction. So a lot of people, when they think about broadband, they think about access, which is, do I have internet? And that's absolutely important, but that's not the only factor when one should be thinking holistically about broadband. When we think about broadband and broadband opportunity, we think we've identified four key pillars. Access is the first one. Without internet access, of course, you can't participate online. The second pillar would be affordability. If you have internet access, maybe it's available to you at your house, as in like a provider serves your house, but if it's not affordable, you're not going to subscribe and you're not going to be able to use it. So it has to be accessible and also affordable. You also need a device. Maybe you have internet access, maybe it's affordable, but without a laptop, a phone, an iPad, something of that nature, you're not going to be able to participate online, even if you can afford it. And then the final pillar would be digital skills. Digital skills is, okay, I have the other three pillars. Do I know how to properly use them? And we find that being a common intersection when it comes to internet democracy, if you will, and also telehealth. And we'll talk more about that in the future, but that's how our office defines broadband opportunity. It's having all four of those key pillars.
Thank you, David. Mr. Tipton, the terms telehealth and telemedicine have been used interchangeably. Could you define these terms?
Sure, happy to do so. So appreciate being here. I should start in answering this question by saying I am not the telehealth expert. There are people who specialize in, the technology of this. There's people who specialize in the healthcare of this. As you heard, David and his team can certainly talk about the broadband aspects to it. So, my angle on this is philanthropy and the ways in which we can go about addressing those issues via philanthropy. So want to sort of make that caveat. That said, I think when we talk about telehealth or telemedicine, we're basically using a catch-all term, which describes using technology to access healthcare. It's usually, leveraging a smartphone or a laptop or a tablet to be able to get access to healthcare. So that definitely includes things like having a doctor's appointment via your phone. So, I've done it. I imagine various other people have done it, where you have an app through your doctor's office or your insurance company, where you can talk to a doctor quickly, where you can diagnose a sinus infection or get a prescription called in. So that sort of work is definitely included. But telemedicine also includes a whole variety of other things. So we can now do remote monitoring of vitals. So rather than just going into your doctor's office to get your blood pressure checked, they have cuffs that connect to the internet, and will send that directly to your doctor's office. It could be a phone call or texting with a mental health provider, or doing other healthcare access via platform. Basically anything where technology can be used to extend or to reach people where they are in terms of getting access to healthcare appointments or healthcare resources, very much counts in the category of telehealth or telemedicine.
Thank you, Michael. During the COVID-19 pandemic and subsequent shutdown, we became more reliant on high-speed internet. More of us were teleworking, students were attending school virtually, and patients were participating in virtual medical appointments. Mr. Lehman, COVID brought awareness to barriers people experience accessing broadband in the U.S. and in our state. What is the prevalence of broadband access in Louisiana? And as a second addition to that question, what is the governor's office doing to ensure everyone in Louisiana has access to affordable and reliable high-speed internet service?
That's a fantastic question. And if you'll allow me, I'll go back and answer that question over the course of a few years. So really, broadband in Louisiana started in the year 2019. All these initiatives started in 2019 because the governor was going on a tour of the state. Now, he comes from a rural area himself, Tangipahoa Parish. As he was going on this statewide tour, getting to learn those communities and talk to those communities, he noticed broadband is critical. Parishes that had broadband were well off. Parishes without broadband were not as well off. So he realized very quickly, okay, this is an important issue. To really elevate all of Louisiana, we're going to need to ensure that everybody in Louisiana has this access. He saw that 1 in 3 Louisianians did not have this access. That's a sizable number. So what he did was he created the Bell Commission. That stands for Broadband for Everyone in Louisiana Commission. And they immediately got to work identifying this need and starting to strategize solutions. That was in 2019. We all know what happened a few months later. The pandemic hit and the legislature saw this same need. They saw this need and they said, okay, Governor, we like this task force. We're going to put this task force into statute. We're going to create a dedicated state office of broadband, also known as Connect LA, where I work. We immediately got to work ourselves, looking at those solutions, and we identified that this is really a $1.5 billion problem. So to connect these 1 in 3 Louisianians, to connect all of them, it would take a sizable amount of funds. Fortunately, you had the American Rescue Plan Act that was passed in 2021 that allocated roughly $200 million to Louisiana, and we did that via the Gumbo Grant Program. We issued many awards, and those projects are underway. Shovels are in the ground. We've actually had ribbon cuttings already. Specifically in St. Martin Parish, we've had a ribbon cutting. Fantastic. This is fiber underground serving people's homes, their addresses. Then you have the infrastructure law, the federal bipartisan infrastructure law, which allocated $1.3 billion to Louisiana. That's really what's going to get us to serve everybody. The Gumbo program was a down payment on the home. This is the mortgage that we use to pay off the home and to pay off the problem. We expect to receive approval for those funds shortly. And we're immediately going to go to work issuing grants via the Gumbo 2.0 program in 2024. Once we issue those grants, everybody's going to be on a 5-year shot clock to deploy and to construct. So that was a lot of information, but that's really what the problem for broadband is in Louisiana, how our office is working to solve that problem, and the timeline moving forward. There's going to be a lot more shovels in the ground in 2024, and we fully anticipate that really by the year 2029, every single person in Louisiana, every home, every business, every address will have access to high-speed, affordable, and reliable internet, which will then can be used for telehealth.
Thank you, David. Although telehealth use increased during COVID, there are disparities that persisted among populations and insurance types. According to a report published by the U.S. Department of Health and Human Services, Assistant Secretary for Planning and Evaluation, telehealth use was lowest among people who were uninsured during their study period. Also, individuals who were Hispanic or Latino, Black, and Asian were more likely to use audio-only telehealth than individuals who are white during the same period. David, what equipment is required for a telehealth appointment?
That's a fantastic question. So not only is it important to have access, like we've talked about, but you also need those other 3 pillars. When we're talking about telehealth in particular, somebody needs more than a laptop, an iPad, or a phone. They also need specific telehealth technology. So I really appreciate how Michael was talking about, a cuff link that can record your vitals and then upload it and send it to your doctor automatically. We're finding that that's an additional burden, really. It's a tool, but for somebody that can't afford it, that's another additional thing for them to buy and to learn how to use. So like all tools, it could be used properly, but it could also be completely neglected. In particular, when we're talking about minority communities, they lack a lot of resources to begin with. They lack a lot of the broadband access resources to begin with. Now we're telling them, okay, telehealth is great, you're also going to need these items and these skills. That could be a problem or a challenge for some of them, because you have to tell them, okay, congratulations, we provided internet to you. By the way, to fully utilize this, you're going to need more devices. It's going to have to be affordable. And you're also going to need the digital skills training, and they're going to need that.
Thank you. Michael, what barriers did community members encounter with telehealth during the pandemic?
So I think David's responses sort of speak to some of these different barriers. So there are obviously structural barriers. So as was noted already, some places in Louisiana currently don't have structural access to high-speed internet. There's not a fiber or a service there that's available. And certainly if you don't have high-speed internet or internet that's fast enough, doing a video telehealth isn't really an option. There are places where cost is the barrier, where it might be available, but it's not affordable, or it isn't affordable to the person who needs it. And so that's the reason why they're not signed up or not able to get access. There are occasionally some structural barriers built in systems. So we saw this particularly during the pandemic where there were devices or services made available to the internet, but they might be exclusive for educational use, not for telehealth or not for something else. I think a lot of that has gone away, and it's become sort of broadly accessible that you should be able to use the internet for job, for school, for telehealth, et cetera. But that was a barrier in certain places based on sort of narrow definitions. And then there's obviously a knowledge barrier. If you got access, but you don't know how to use the device, use the tool, then you may not necessarily feel comfortable using it, or may not necessarily take the step to use it. One of the things I think is interesting is I think most people assume that the structural barriers or the cost barriers are the reasons why people wouldn't use telehealth. And I think that's very much true. But generally speaking, when we looked at data, particularly during the COVID pandemic, the driving factor of telehealth usage wasn't those things. It was if your doctor or your clinic or wherever you go see healthcare was asking you to use telehealth. If they said, hey, I want to help you do this, we think it's important, then there were all sorts of ways to overcome those gaps. And if that wasn't the case, then there wasn't necessarily a reason to do so. So there needed to be a compelling reason to start using telehealth. And so certainly, we can talk more about it, but that's part of why I think what David, what Vineeth, and the team at Connect LA have done is just so important, of really working to address those issues from a structural basis, from a cost basis, from a knowledge basis, to address those issues and to find ways to bring telehealth to people wherever they happen to be.
And could you tell us more about what Blue Cross Blue Shield Foundation of Louisiana is doing to improve telehealth access in underserved and under-resourced communities?
Yeah. So part of what we've done in partnering with David and Vineeth and team at Connect LA is to try and understand what they are already doing, what they're going to be able to tackle. As you heard, through grant programs, through the work that the state's doing, a lot of the structural issues, putting fiber in the ground, bringing access to key places, that's going to be addressed over time. And so part of what we tried to do is say, well, what are the ways that we as philanthropy, we as the Blue Cross Foundation can help to meet those needs in the shorter run? Where are the places that aren't going to be hit for several years? Where might there be pockets of need that we can address today? So we overlaid our health data with states' broadband data and looked for pockets and places where there was going to be a need for some set of years, 5, 10, 15, and where we thought there might be some unique solutions. And so one of the things that many folks may not know, and actually I didn't know until engaging with David and the team, is that way back in the 1990s, Louisiana set up high-speed internet to effectively all libraries and most other large public facilities in the state. So while we talk about not having access in certain places, the library in that community may have access. And so that became sort of this hub idea of saying, well, how could that be used in a powerful way to meet the need? And so we certainly saw this during the pandemic, where some libraries turned on public-facing Wi-Fi or made themselves available in a way. And so we wanted to sort of expand that idea and say, how might we take this to the next level? In talking with libraries in many of those communities, we realized, and we'd originally thought this was probably as simple as saying, let's set up telehealth stations in some of these libraries. And we realized it really wasn't one size fits all. Some places, yes, wanted telehealth stations. Some places wanted to make their Wi-Fi publicly accessible. Maybe it wasn't already. And so people could come and use their phones to get access to a telehealth. Some places actually had telehealth stations and public Wi-Fi, but their community didn't know about it. And so we set out to use our resources through grants and through partnerships to try and address that slate of issues so that telehealth could be more accessible in rural and high needs communities in ways that really adapted to that local need.
Thank you, Michael. Okay, these questions are for both of you. There are healthcare provider deserts and maternal care deserts, counties, parishes where access to maternal health care services are limited in rural communities. Due to differences in broadband availability and affordability, there are also disparities in telehealth access in rural communities. How are Connect LA and Blue Cross Blue Shield Foundation of Louisiana working to improve maternal health care and healthcare access in rural communities? And how are your organizations engaging healthcare networks and healthcare providers in improving telehealth access and services across the state? And
Michael,
David?
I'm happy to answer the first half of that question.
Go for it.
So in addition to our Gumbo grants that are access, we do a lot of robust stakeholder engagement. We're no stranger to waking up at 5 a.m. and leaving at Baton Rouge and traveling to North Ida, Louisiana, which is basically on the border of Arkansas and Louisiana, to give people an update on everything our office is doing, and then coming back and making sure that we hit as many stops as we can, and then being back by 9 p.m. We're no stranger to that. I say that because stakeholder engagement is very important. These are people that you can't just send a newsletter to and expect them to read it. They don't have internet, first off. So we find it's very important to go meet them where they're at. So we provide those updates on this is what the status of internet access is, but also this is how you could be thinking about the future and how to utilize and leverage this. So we definitely talk about those grants. We also talk about what's called the Affordable Connectivity Program. What the Affordable Connectivity Program is it's a federal program that gives people $30 a month off of their internet bill, something that helps them with that affordability aspect. Also, it's $100 off of an unapproved device. Devices are very important. Once they have these Gumbo grants, once they have this Affordable Connectivity Program, then they're able to think long-term and strategically about, okay, now I can see how this is going to affect my life. Now I can see how this is going to affect my maternal health care. This is going to affect my, just my telehealth in general. That's primarily what we do. And then Michael has been a fantastic partner at Blue Cross Blue Shield to really provide that knowledge and training. Okay, great. You've got access. You've got the device. Now this is how you can think about telehealth in particular.
Well, and I'll just echo, first I'll say David and Vineeth and team are among the hardest working folks I've met in state government. I mean, I'll echo their point. I've seen them on the road at various early hours. So kudos to you all. And I agree. I think meeting people where they are is a critical part of this, and explaining a concept that can oftentimes feel ethereal and technical in ways that are real and meaningful. And here's how you can get access to something you care about here in the short run by taking specific steps. So, to the question of accessing healthcare, accessing maternal health, I think one of the things we had to sort of look at very early on in this conversation of partnering with libraries or partnering with telehealth is whether we wanted to be specific in terms of a provider or in terms of an insurance company. So, I work for the Blue Cross Blue Shield of Louisiana Foundation. We at Blue Cross have an app where we can use telehealth. It's what I use. So do other clinics. So do many of our hospitals in the state. So do other insurers. So do different Medicaid plans. And so one of the questions was, should we be provider-specific, insurance company specific, and ultimately we decided no. We wanted, yes, there are these proprietary tools out there, but we wanted anyone, anywhere to be able to access, and there are tools and resources that can make that happen. And somebody should be able to log into the internet and log into, yes, a proprietary thing that connects specifically to their doctor, but also to whatever is right for them, meeting their needs. So generally speaking, our encouragement is to tell people to talk to their doctor, or if you don't have a primary care doctor, get one, and be clear with them about any technological limitations. If they say, well, we want to do a telehealth visit and you don't have the device to make it happen or the internet strength, talk to them about that. Most healthcare providers in Louisiana are getting increasingly tech savvy and are willing to work and identify ways to help meet people's needs. And there's real benefits to that. So if I talk about maternal health, for example, some set of the maternal health visits people go into a doctor's visit in our doctor's office for are actually blood pressure checks. And you can do some of that remotely. If you live an hour away from your doctor and you can save the hour drive there, the hour appointment, and the hour drive back, and you can do that 2 and 3 times, we're talking, 5, 10, 15 hours of your time saved, not to mention money, not to mention other dynamics. So there's a whole variety of ways in which this technology can be used to really improve outcomes and improve people's quality of life. But you have to be transparent about it, clear about it, and accessible about it with your doctor, and work through some of those initial barriers to make it feasible.
Thank you both. Louisiana was awarded over $1 billion to ensure everyone in the state has access to affordable and reliable high-speed internet service. David, what resources are available to assist people with low health and digital literacy skills, people with different abilities, and people residing in rural communities with using telehealth?
That's a fantastic question. So yes, we were awarded $1.35 billion. And that's primarily going to solve the access prong of digital opportunity. However, we do strongly think that there will be money remaining within those funds that can be used per the federal law for what's called non-deployment. Non-deployment is anything that's not construction to provide access. For example, telehealth or affordability or devices, workforce development. Those are all non-deployment initiatives. So we don't know exactly how much money we will have for non-deployment remaining. We think we have an idea, but we're not sure yet. It will really depend on the grants that we issue to provide that access. We'll have a much better idea around middle of 2024. However, that's not really the only bucket of money that we can use for digital literacy. We also have what's called digital equity grants, or in Louisiana, we're going to call that digital opportunity grants. You can read our digital opportunity plan on our website at connect.la.gov. It's a very lengthy document. I'm going to summarize parts of it right now, though. When it comes to digital literacy, primarily, we are partnering with Board of Regents and also libraries to really spearhead what's called the North Star Digital Literacy Program. It's a program that already exists and is underway in Louisiana, where people can log on, create an account, and they will need access and a device to do so, but they can go to their library, log on, create an account, and start going through trainings on just about anything technology related. Trainings such as how to send an email, how to make a resume, those kinds of trainings. Not only do you take the trainings, but you also get a digital badge that you can put on your profile. So as you advance and get better and better digital literacy skills, you can start marketing yourself to potential employers and say, look, I'm digitally literate. I'm workforce ready. I can do this remote job, or I have these telehealth skills. That's a fantastic resource. So we're very grateful to the Board of Regents and also to our library system for that. It's something that we're very excited about. That's already underway. We look to really expand this as our digital opportunity grants kick off late 24, early 25. But also as we start looking at non-deployment in middle of 2024.
Thank you, David.
Thank you.
This year, the Blue Cross Blue Shield Foundation of Louisiana, in collaboration with Connect LA, awarded $50,000 in funding to 11 library systems to offer telehealth services in rural communities. Partnerships are also an important resource. Michael, why was it important to engage the state library and municipal libraries in bridging the healthcare access gap in rural communities? In addition to funding libraries, do you plan to fund other organizations?
Thanks for the question. Short answer is yes. We at the Blue Cross Foundation are committed to improving the health and lives of the people of the state of Louisiana. Telehealth and access to broadband is certainly a part of that. And actually, we've had a couple different partnerships. So outside of the grant you're referencing, we have a standalone grant we made to the Rapides library system. They reached out to us independently with some nuances that they thought needed to be met in terms of bringing telehealth access. Our approach is to both be very open, and we take grant applications on a quarterly basis from organizations across the state. But in the case of exploring this new sets of issues, we realized we didn't have a way to get the message of our interest in this topic to partners all across the state, to those libraries that had the areas of greatest need. And so partnering with the state library and their association was a way that we could say, hey, we're interested. We could have that conversation and develop a real relationship and some connectivity in one place and leverage that existing network to get to the places where there might be the most need, and where we could then start sharing some best practices in real-time ways that go even faster than might come in via a sort of grant process, because certainly this is going to be a learning iteration. What works in one rural community may work the same in another. It may not. And so that sort of spirit of partnership and that collaboration is something we are interested in. And I'd say more generally, we're open to exploring the margins of this and the edges of it. There may be communities that say, hey, our library has this telehealth program now and has access now, and what we really need is XYZ. If it works to improve the health and life outcomes of the people of the state of Louisiana, we're interested in, whether that's addressing the healthcare workforce, technology, program access, et cetera. If there's a way that a grant might meet that need, we're open to the conversation and to seeing how we might be able to help.
Thank you. David, when we think about your role in improving broadband opportunities in telehealth, what lessons have you learned?
It's really meeting people where they are and understanding that where I am, I've had the internet for decades. Other people, they have not. It might be something they're familiar with, but chances are, all these abstract concepts, telehealth, AI, virtual reality, all that stuff, it's stuff that you and I might be familiar with. But to somebody who has not had internet, they just need help. They just need help using the internet and using the device. They're just tired of, driving an hour to the doctor's and then driving an hour back. This really helps streamline them. So it's very important to meet them where they are and also to understand their level of skill.
Thank you. Michael, what lessons have you learned about broadband access and telehealth from your role with Blue Cross Foundation?
So I'll say that I'm going to reference specifically the grants we made, and I guess I would say it's early. We've seen a whole lot of excitement about expanding access and bringing telehealth to areas that it hasn't been before or hasn't been as needed. And I think that's fabulous. But the performance data, we don't have yet. My best guess from what we've seen in other cases is that what we're going to see is that there's going to be some good usage, and I think it's going to really meet some needs. But I also think frequently this is both a barrier and a perceived barrier. And so helping communities and people know that they can access it in a place that they might otherwise go, a library or another tool, doesn't necessarily mean that they're going to. Sometimes it's just the point of saying, okay, now I know I can, and now I can actually ask my doctor the question of, should I? Is this an option? And that becomes the conversation that then opens up the door of engaging. So, I think we're going to learn a lot over the next series of months and years. And then we're going to really start pushing the margins of what may be possible. I think there's all sorts of things out there that we can certainly talk about that open new horizons for communities. Everything from real-time translation. So if we deal with communities that may not have a translator or an ability to engage in a different language, that's something that the internet can do. There's ways that we can do doctor-to-doctor consults or remote medical monitoring, all things that can change outcomes in really powerful ways. And so I think we're just beginning to scratch the surface of what's possible once we deal with some of the structural barriers that have been the reasons why people couldn't get access in the past, or why it didn't seem like a thing that they really could engage with.
Thank you, Michael. Before we conclude, I would like to ask each of you one more question. David, when you think about the future of broadband access and telehealth in Louisiana, what are you hopeful about?
Yeah, when it comes to broadband, I'm very excited about the educational opportunities. I'm excited about the productivity, the economic development, and the telehealth. So a few years ago, if you'll recall, Medicaid didn't exist, or Medicaid expansion rather did not exist in Louisiana. The governor expanded Medicaid via executive order. We're already seeing the number of insured residents in Louisiana increase and the number of uninsured people decrease. That's a very exciting figure because that means people now have access to healthcare. But that's healthcare that might be without telehealth. When it comes to telehealth, I'm very excited about people very conveniently logging on, doing a test, consulting with a doctor, and it doesn't take more than 30 minutes of their time. Whereas previously, like Michael was saying, they might have to drive an hour each way. That's 2-3 hours. That's half your day right there. People who really need help, they're probably not going to sacrifice that much time. They would just go without an appointment or they would go without a checkup. I'm excited for the convenience. Not only is it convenient, it's going to have better outcomes for our citizens. It's going to increase the quality of life throughout Louisiana. Long-term strategically thinking, I'm excited about the innovation that's going to come. I was talking to Senator Cassidy a little over a year ago in Alexandria, and he said, man, like I'm reading reports about this technology that's being developed where a doctor in Arkansas can log in, see a patient in, Louisiana, perform a diagnosis, potentially do a surgery, like via telehealth. I mean, that's very forward thinking, but Senator Cassidy, he's also a doctor himself, as you know. I'm excited for those kinds of innovation that comes. We're barely scraping the surface of what's to come, and I'm excited to see how, we innovate with this new technology as we expand it.
Thank you, David. Michael, I will ask you the same question. When you think about the future of broadband access and telehealth in Louisiana, what are you hopeful about?
So, I mean, no surprise to anybody on this call, but we have a whole lot of issues in Louisiana, many of them related to health. And I'm hopeful for all the ways that broadband can be a tool to address those issues. Yes, with people's jobs and opportunities. Yes, with direct healthcare. But I think there's a whole lot of other components too. So I certainly don't think it's a silver bullet. I don't think there are silver bullets, but I think it's a tool that can really help level the playing field. So I'd say a couple things. I mean, one, I'm excited about the fact that we have a broadband plan and a team leading that plan that I would say is one of the best in the country. I don't want to brag too much on David and his team, but I think they deserve a lot of credit. It's really good and thoughtful work that is meeting people where they are and really addressing some powerful needs and issues. And so I think that's critical. And when you've got a really good plan and you can then start combining access and affordability with tech literacy, the sky's the limit in terms of what we can do. So, I think when we talk directly then about healthcare and what that can mean, I think we've seen data saying when you look at an issue like mental health, there are a certain set of people who prefer to access mental health care virtually. And what does that mean for expanding access in a critical area of issues? I think, the sky's the limit in terms of what we could do. When we talk about rural communities where we might not have a primary care provider or a specialist. What does it mean to not spend, as David noted, your whole day driving into a city, but when you can log on via the internet and talk to that specialist? When we start talking about referrals, there's some data out there that says about 50% of the referrals where you get sent from one doctor to another doctor don't need to happen. You could use telehealth to do a real-time consult and say, nope, we can do that via remote monitoring, not a follow-up that's needed. What's the time savings? What's the cost savings? What's the improvement in people's health and life outcomes when they can get that done immediately as opposed to waiting 6 weeks, scheduling another appointment, driving more, et cetera. I think the sky's the limit in terms of what we can do. And so we got to address the short-term access and structural barriers. But I think the ways that this gets used can change people's lives in really positive ways down the road.
Thank you, Michael. And this conversation has been great. And I'll also say that I'm very hopeful for the positive changes to come for broadband, telehealth, and digital literacy in our state. So on that note, I would like to thank David Lehman and Mr. Michael Tipton for participating in this insightful and informative conversation. This concludes our first masterclass discussion. Please stay tuned. We will share the link to the recording and the schedule for upcoming events with our partners shortly.
Thank you. Thank you for having us.
Thank you.